From the News Channel 5 network, this is Pharmacist on Call.
Good evening, Nashville, Middle Tennessee, our friends in Southern Kentucky, and those of you who can view us in West Tennessee, even as far as Jackson. Welcome to Pharmacist on Call. Your host, Dr. Shawn Pruitt, owner of Pruitt's Discount Pharmacy, located in Nashville, Tennessee. And if you are watching this show, I am your community pharmacist. Well, here we are on our second show. We appreciate you tuning in to us. This show kind of spurned off, as I mentioned before, from the Open Line series, Ask the Pharmacist. Because of your participation, your calls, your support for that show, we now have this show where we focus pretty much on your calls, your questions, and your suggestions. So feel free to call in, 737-7587, that's 737+, with any questions, any comments, if you have information to offer. Rule number one again, there are no stupid questions, so give us a call, 737-7587. Just wanted to attend to a little old business. There were a couple of calls last week that I probably need to kind of redress. The first was a gentleman who called about a medication called Cimzia, which is used to treat Crohn's disease, and he wanted to know about the incidence of cancer taking that medication. So, sir, if you are watching this show, looking at the research, there does appear to be increased risk of certain types of cancers while taking Cimzia, again, the drug for Crohn's and rheumatoid arthritis. If I could kind of briefly describe what's going on with that and why that is, that drug blocks a cytokine or an immune response chemical called tumor necrosis factor. So what tumor necrosis factor does is it stimulates the immune system and it tells things like cancer cells to die. Well, that drug Cimzia blocks that effect of that drug, telling the cancer cells to die. So when that is not there, the tumor necrosis factor to tell the cancer cells to die off, then they can proliferate. So that's kind of why that increased risk is there. But yes, sir, to answer your question, if you are watching, there is increased risk with Cimzia, those of you who are taking it for Crohn's or rheumatoid arthritis. The second thing was, I believe her name was Dot, a lady who called in on the first show, and we talked about a drug called risperidone, and she wanted to know pretty much what it was for, so we kind of deduced that it was for bipolar disorder or schizophrenia disorder. She was out of her medication and, kind of at her wit's end because she wasn't able to get it, so I wanted to let everyone know. I was able to speak with her a little bit, maybe a week or so after that show took place, and that she was able to get her medication, and she's doing fine, but through her own actions, she just, I guess, kind of needed a little push and know where to go. So kudos, ma'am, for taking charge of your situation and getting yourself better. I wanted to finish up with allergy season, but we have got a call. So we're going to start taking Mike on line one.
Good evening, sir. How are you doing?
Pretty good. How are you?
Doing great. Hey, I've got a question to ask. Me and my church, we go up and feed the homeless in Nashville. And I'm looking down the road. I'd like to get them a bigger building where they can come and stay and get jobs and get education stuff. My question is to you, sir, if I got this going, is there any pharmacists close around in Nashville that maybe could help me get medicine down the road for the homeless, or do they need to come there or to go to a doctor and be checked out first, or what they might need? And I'll hang up and appreciate all the hard work you're doing, man.
Don't hang up. Re-ask your question there.
Yes, sir.
Okay. Re-ask your question again, please.
Sir?
Re-ask your question again, please.
Okay, my question is, me and my church, we go up and feed the homeless in Nashville, everything.
Mm-hmm.
And I'd like to know is, eventually we want to try to get a bigger building for them where they can get jobs and stuff. And lately, a lot of them have been real sick. And I just want to know, is there any pharmacies around in Nashville that maybe be able to help me and my church down the road if once we get a big building set up where they can stay and start getting job training and stuff? If they did need medicine, is there any pharmacists up and around Nashville that might be able to help us out?
Yes, sir, there is. There is Pruitt's Discount Pharmacy, who does serve homeless shelters, patients who are the Salvation Army. So we currently work with indigent programs. We work with churches who provide medication to patients. So give me a call. That's something that we would be very interested in participating in. And that's kind of the mission of the pharmacy, to take care of those who are uninsured, who aren't blessed with insurance, who have a number of medications that they take, but they need them at discounted prices because the full price is a little bit out of their reach. So give me a call. We're going to have the information up at the end of the show. But make sure you give me a call. I'd be very interested in helping you with that program. All right, everyone. It looks like we have Jean on line 2. Jean, welcome to Pharmacist on Call.
Oh, thank you.
What's your question, Jean?
My question is, what kind of medication you have or can recommend for anemia, or when your red blood cells need to be built up? And also give me a little bit of information if you have the shot Procrit.
Procrit?
Procrit, yes, sir.
Okay. Well, Procrit is epipoietin, which is, I don't want to say a hormone, but it's a substance to stimulate the production of red blood cells in the body. So that's what that is. If you want to do some other ways of increasing your red blood cell count, certainly if you're not much of a carnivore, you can do red meat, but you probably need to get into your green leafy vegetables, your kale, your spinach, even your turnip greens. And then you may also have to supplement with an iron supplement. Ferrous gluconate, I think, would probably be your best option. People seem to absorb the iron better. Make sure you take that with something like orange juice to increase, the iron absorption even better.
Where are you located?
I'm at 811C Dickinson Road. So if you're familiar with where the Jefferson Street Bridge is, we're about maybe a quarter of a mile to a half a mile headed away from town. As I tell most people, we're about a mile and a half from LP Field, where the Titans play.
Okay. Now, the iron pills, if you're allergic to the red dye,
okay,
that's the reason I was asking for something. The Procrit, they said the side effects were possible downstroke or heart attack. So that's why I was kind of leaning away from that. Well,
the ferrous gluconate comes in a green tablet, so you should be okay with it.
Okay.
And they're relatively inexpensive. I don't think they're maybe $5 or $6 at my store.
Okay.
But again, I would rather you get it from your diet than supplementation. So if you can, increase the green leafy vegetables, a little bit of red meat here and there, depending on your blood type. But certainly your green leaf is going to be your best source of iron.
Let's see, I'm swollen from the edema.
Edema, okay.
From the third stage of kidney failure.
Ah, okay.
So that still will all help me.
Ma'am?
I said, so that still will all help me, the leafy vegetables and stuff.
Yeah, I would think so. Yes, ma'am.
Well, thank you for taking time to talk with me.
Yes, ma'am. You're welcome.
Bye.
All right. Thank you. All right, everyone, feel free to call in with your questions. There are no silly questions. That is rule number 1. So whether you think they may be silly or not, give us a call. Chances are that question that you have on your mind may not only help you, but someone else. I wanted to take a second, since we're in the cusp of allergy season, to talk about it a little bit and some of the things that you can kind of help to help yourself relieve yourself of those symptoms. As you know, Nashville is probably rated one of the top cities for every one of the allergens that are out there. So you'll probably see the yellow stuff sitting in your car and all that. So some of the things that you can do to help yourself with allergy season are antihistamines. 2 or 3 come to mind. First, the non-sedating, which would be the granddaddy of them all, Benadryl. You would probably take those maybe 1 every 6 hours, a 25 milligram capsule. The knock on it is, once again, that it does cause marked drowsiness and dry mouth, which are the anticholinergic effects that you'll get from that drug. Along that same lines, physicians are now starting to prescribe the antacid medications because they work in the histamine receptors as well. So Your Zantacs, your Tagametes, your ranitidines, those are now being used to help with allergies. Your non-sedating antihistamines, they're going to be your Claritin family, or loratadine is the generic, your Zyrtec, which is going to be cetirizine, or the Allegra, which is the fexofenadine. And people always call and ask me, which is the best? Well, that's going to be kind of individual for each person. So Claritin may work for me, but Allegra may work better for you. Tied into that whole allergy piece are sinuses, along with that cascade. The allergy piece is the allergic rhinitis, the clear, runny nose liquid, the sneezing, the swelling of the eyes, mediated by the histamine, but you also get swelling and congestion in the nose, and so that's going to necessitate a decongestant. But I'm going to get into that a little further, but let me get onto these calls here. Laura on line 1. Welcome to Pharmacist on Call. How may we help you?
Yes, I wanted to know the shelf life of fluconazole. I guess that's how you pronounce it.
Fluconazole?
Yes. What is the shelf life?
Shelf life of an unopened package?
Yes, sir.
The expiration date is going to be on the package there. So if you look on there, you'll see expires, because it should be in a sealed package.
It is a sealed package.
Yes, ma'am. So whatever that expiration date is, that should be it. Okay.
If it go past that, if I take it, if it was past it, will it hurt my body?
Well, the verdict is still out on that. Some expired medications, I will even take up to 6 months after expiration. I generally don't suggest most people do that. It just depends on the medication. But how far after expiration was the medication?
This one has, I'm not sure. I'm looking at 2. I'm not sure. I think it was 10. Oh, I see it. It's, I think it's 10/13 or something like that.
October 2013. Now, is that on the prescription label, or is that on the package itself?
Oh, no, I'm reading it wrong. It says discard by 3/30/13.
Discard by 3/30/13. Now, is that your prescription label, or is that the package itself?
Oh, that's the prescription label says 10/20/13.
10/20/13. I think it's okay. The only issue you have to worry about is the decrease in effectiveness of the medication with that number of months behind it.
Okay, so it's too far out. Shall I say that? Has it broken down?
Yeah, it's probably starting to degrade at that point.
Oh, okay. Mm-hmm. So it's no good right now, right?
I wouldn't say no good, but it's probably not 100%.
Okay. Mm-hmm. Yeah, because I know sometimes pills, even after expiration, they don't break down because of the compound of the medicine that's on the inside of it. It's still it still stays on the shelf.
Yes, ma'am. And so it's in a sealed package, so I wouldn't say it is degraded totally.
Okay. Mm-hmm. Thank you.
Thank you, ma'am. Okay. All right, everyone, we are going to take a quick break. Stay right there. Those of you who are on hold, we're going to get right to your calls when we come back. We'll be back in a minute.